I am a physician by design training and had a childhood bone disorder, which resulted in my leaving clinical medicine as a surgeon. And in 2010, had a total femoral prosthesis implanted in my left leg. So almost literally the $6 million man. I mean, you talk about the cost of healthcare, and I am not kidding. This was like amazing. So I am titanium from my pelvis down almost to my ankle with no bone in between. In 2010, I had the misfortune of having that prosthesis get infected. And through some very aggressive treatment here at the Brigham, I was able to keep the leg as opposed to either amputation or going ahead and trying to redo the prosthesis, which is a very lengthy and very risky series of operations. Through IV antibiotics, though, I had to have a catheter in my left arm for various periods of time, and I had 7 surgical procedures since that time. And finally, I had the misfortune but good fortune of meeting the 2 gentlemen to my right in December of last year when I developed a very large blood clot in my subclavian vein going up toward my neck. So after a couple days in the ICU and some good roto-rootering, I was cured almost instantaneously. It was just absolutely remarkable being in the cath lab and being able to have that outcome. I liked it so much, I did it again. In June of this past year, it was quite remarkable. It was after another surgical procedure where they put the catheter. I said, Dr. Goldhaber, can I still have a catheter if I need it again? He goes, yeah, just use the other arm. Thank you for that wise sage wisdom, because I actually did, and it also clotted. The interesting part was I was on an anticoagulant fragment at the time, so I'm known as the FF, the fragment failure. And I had the good fortune of being treated and with more conservative measures, and I'm now on Fondapurex. Thank you. And doing quite well with that. I will say that when it comes to adherence, these talks are so spot on. It's almost uncanny, because even as a physician, I forget. Okay, I'm on 6 different medications. I'm on 3 antibiotics depending on the day of the week. And when I have my injection at night, the best strategy I have is to link it to my activity of daily living and activity of daily living. So it's really simple. It's shower shot. I shower, I shout, I shoot. I shower, I shoot. I shower, I shoot. I travel a lot on business. Before I do anything, I put a whole variety of medications in my bag, in my toiletry bag. So I'll always have that there. And it works quite well if I link that. I actually did, when I left clinical medicine, I went to Harvard Business School, got my MBA, and my career since then has been starting companies, very entrepreneurial-oriented companies. The company you showed with the light, that ambient light technology here with the glowing caps, I actually looked at many, many years ago. I don't even know if it's the same entity, the same folks that were doing that. But what was fascinating to me about that was not just that it's a reminder, but you can also link in a social networking or a social media aspect to that. So, because many of us in the room are the sandwich generation, it's not just a reminder to the patient, but when I'm in California, or my mother's in California and I'm here, in my bathroom, there's a little glow stick, so to speak, next to my mirror. It glows when Mom forgot to take her medication. So the power of social media and social support is very, very powerful.
Rajan, you're not in the sandwich generation.
No.
Do you want to explain to those gathered sort of how you ended up in the hot seat, and also maybe a bit about our youth advocacy that you helped get started?
Right. So I am a senior in high school in Windermere, Florida. I've had a lot of health problems throughout my childhood, one of them being scoliosis. So I had surgery to help fix that. And the day after the spinal fusion, I suffered a massive pulmonary embolism. And because of the circumstances surrounding my case, the NATF actually invited me to travel up to Boston to participate in their closed working group sessions last year in September. And they also elected me to be the young adult representative of the Patient Advocacy Committee. So since then, recently I was able to have my first meeting in a patient support group. 4 people showed up where we shared our own experiences about PE and DVT. And we also discussed certain medicines like Lovenox and Coumadin and other medicines that can help decrease the risk of developing PE and DVT. I've also I've attempted to recruit some of my friends in high school. Right. Also traveling up here with me is 2 fine young people from Atlanta, Amruta Hode and Ame Hode. So they're heading everything in Atlanta, trying to raise awareness of PE and DVT up there. So they're organizing talks at Georgia Tech, at Northview High School. They're also they've made some contacts about Emory, I believe. Yeah. Right. So I was prescribed with enoxaparin injection 2 times a day after I suffered my first PE for 6 months. And when that was done, 2 weeks later, I suffered another massive PE. So now I'm still taking enoxaparin, and now I don't let it bother me at all. I just like you said, you just do it without any thought. I do the same thing. I was actually a few weeks ago, I was at a sleepover for one of my friend's birthday parties, and everyone was just watching me awestruck as I was doing my shot, and I was like, oh, what's so great about it? It's just an injection. They're all just sitting there with their mouths open. So
I think you and Dr. Ober are models for patient adherence. Any questions or comments for the 2 patients on our patient panel?
Can you tell the audience, Rajan, what you said to your high school in your high school talk about your illness?
When I did talk to my high school, it was a 40-minute presentation about the dangers of PE and DVT and how people can raise awareness. I ended with this final statement for them to think about. I said, I will not be defined by my illnesses, but my words and how I overcome adversity.
And we have your parents and grandparents. So I think we have a cardiologist father, cardiologist grandfather. So I think your medication adherence, I'm guessing, was pretty good.
Yes.
Pretty good. John, any comments about how do we raise the general level of medication adherence to sort of the Rajan or to the Dr. Ober level?
Well, I think these stories are critically important. In my world, these are a success that needs to be shared with patients who struggle with their daily lifestyles and making sure that medications, are taken. I'll also add that I can't emphasize enough that much of the work is done in medicine on discovery. And we don't focus enough attention on the tools that we have in our hands and how well we utilize them. And I think that's the element that has to really come to the forefront. And I think you're going to see more of this, as we start grappling with the elements of healthcare reform, and as our population in the United States gets older. So these are all things that I think are incredibly important. I can't discount the medical advances because they're huge, but I do think we need to focus at some of the things that we have in our hands right now.
Greg, your thoughts?
So I think that what John said is very important. And as I mentioned when I was speaking, there are really many different ways that we can address medication adherence and patient education. There's what we do on sort of a public arena, and there's what we do at the bedside. And for me, it's always important. It's one thing I remember when I see patients in clinic is that even if it takes me a couple of more minutes seeing a patient, to always stop when I'm handing that prescription and explain again why I'm prescribing that certain medication and why it's important that they take their doses. And it's really only been recently where I've started to appreciate the importance of medication adherence that I've really caused myself with every single patient to stop for a second and make sure that the patient understands why this is important. And now here we have these visit summaries that we hand to patients. It's part of our electronic health record. The last thing you do is actually print up their medications, print up their visits that are upcoming, and then you have a little box for some provider comments. And I always take the time to write in that box why they're taking the medication and why they need to make sure that they take all their doses. And even though it takes a little while, I think it's worth it. And clearly what we know about patient medication adherence and its impacts on health, it's important enough to take that time.
Well, Amrita, you're Georgia Tech, correct? How do you get your campus mates to become interested in a topic like this when some of us have the stereotype that when students go off to campus, they tend to often do things in terms of their own personal health habits that are not very healthy.
Right. I think, what's very important for younger people to understand is that this is not just a condition that can affect older people, that it's very, it can happen to us too. And just kind of raising that awareness is very important that, these are the symptoms, these are the causes of it, and it can happen to you, and you should be more aware of what's going on instead of, thinking that it can't happen to me either.
And maybe your brother who's in high school, who's out before, would like to say something.
At least in my community and through my friends and the people that I know in my area, the acceptance or the drive to learn more about a certain condition or certain cause or what may it be is great. So when it comes to spreading the word about, you say adherence, or maybe just spreading the word about the condition, it's pretty easy to get people on board.
How do you motivate others in high school to pay attention to this topic?
It's not just older people that this affects. It's also people our age and people that surround us, like Rajan, and many others whom we may not know about. So when you kind of bring it down to their level and say that, hey, maybe your neighbor's, dad had to go through this condition or something. When you relate it to the person relate it to someone on a personal level, it's much more impactful, and that kind of creates a drive for them to want to know more.
Thank you. Other comments or questions from the group? Yes, please.
I think in terms of spreading the words to the younger generation, kids and college students get it if it's put in perspective based on people who've had it that are relatively their age, such as in their age group. I think the ideal person would be to mention someone like Serena Williams, because I think that most people know who she is. There aren't that many people who don't. Put it in that perspective in terms of what happened and how severe it was and what happened to her. I think that then it becomes a little bit more, it hits home a little bit more. I think they can digest it a little bit more.
Thank you, Pam. That is a good point. What we have considered and talked to Rajan and his parents, that when the lecture, Amrita or Amey, they arrange a lecture, time permitting, we would like to get Rajan in that lecture, before the lecture, address the audience in terms of his own experience in the 2 episodes of PE. I think that we feel may be a very strong point on letting the people know, letting the students know that indeed this is a serious thing. It can be managed, and look, after that, after 1 year, he's fine. So it can be managed, and there is long more life left after the attack of PE.
Well said. Please.
So, Dr. Ryan, again, it's a great presentation, but we have an epidemic. We have an epidemic in obesity, and we can't educate our people to take care of themselves now. I would assume that the proper way to do it would be to start at a very educational level, at the 4th and 5th grades. Tell them exactly how deleterious it is to have the foods and the necessity of taking care of themselves. But if we can't control what they put in their mouth, and we're competing against the McDonald's, it seems like it's going to be a losing battle. The consumption of salt is absolutely exorbitant, and what they eat obviously contributes to the epidemic we have now and the escalating costs of our health bill. So I think it has to be maybe, I don't know, Dr. Ober, something at a 4th and 5th grade. We start them very early and educate them and tell them how important it is to take care of themselves. But to say go out and follow this and do that, I don't know how helpful it's going to be. That's my pessimistic little comment.